Y'all know me, I'm Dr. B, and this is the buzz on lacerations. I'm trying to sound smart when I say lacerations, but you know what I mean. I mean cuts, cuts that probably need to be sewn. So today we're going to talk about the what's and whys and hows of laceration repair. So your kid's gotten a cut. Well, that's great because it means that they're living life and getting outside. What's the first thing you want to do? Stop the bleeding. Pressure on a wound with a clean cloth and elevating the wound if you can is probably the best thing to do. Keep it on there. Don't keep peeking underneath it. Don't keep taking it off there. It's just going to start bleeding again. If it's not bleeding very much, you can wash that with some warm soap and water. That may make it ooze a little more blood. That's actually okay. If it's bleeding a lot, call 911 or go to the ER. But if it's just oozing a little bit, you can wash it, see what's going on there. Don't use alcohol or peroxide. Alcohol is incredibly painful to use. Peroxide bubbles up, looks like something's going on, like you're doing some good. But in fact, using peroxide, using alcohol on a wound will probably hinder healing, and it can cause direct tissue damage. So we don't recommend using either one of those. If the wound is shallow and clean, there's no foreign body in it, you don't think it's going to need a repair, then you can just cover it with a little topical antibiotic ointment and put a bandage on there. I say bandage, not Band-Aid, for a reason. I do not like Band-Aids. Band-Aids usually have that little strip of gauze. It's surrounded by adhesive, and you put that on there, it locks in moisture. It's just not good for the skin. If you have a wound that you want to use gauze on or a bandage on, get the little square of gauze that you can buy in the store. It usually comes in paper and you rip it open. Put that on there and put 2 strips of tape, medical tape, across it, across the top and across the bottom. Don't seal it in. Don't put it across the sides because, again, it's just going to lock in moisture. After this becomes dirty or gets wet, or if there's, it's got too much crusty blood on it, you're going to want to change it. Probably once a day would be a good idea. Again, don't peek under it all the time. And after a few days, you can start leaving that off. But we want to keep it on so it doesn't stick to the clothing, get dirt in it. Wait till it starts to form a little bit of crust, and then you should be okay. If you think your wound needs to be repaired, in my opinion, our rule in the office, you got to get this checked out and repaired 6 hours, 8 hours at the very outside. I think 6 hours is plenty of time. If you wait longer than that, it's probably not going to heal as well. So we want to check this out. Don't wait overnight. Get it checked out if you think it needs to be repaired. What sort of wounds need to be seen by us? Well, a deep, gaping, or an actively bleeding wound obviously is going to need to be repaired, and that's something that we're going to need to see. A dirty wound, something that you can't get clean, something that's likely to get infected, that would need to be seen by us. Anything like an animal bite, anything where an animal is involved, sure there's probably going to be some bacteria that's going to get in that wound, or even a human bite. Human bites are pretty nasty, very likely to get infected, so we'd need to see that, clean it out, and make sure we're doing the right thing for it. Any wound that may have a foreign body in it that we might have to dig out is something that we're going to want to see. And even a smaller wound, if it's over a joint or something that may reopen over and over, might need to be repaired. So over the joint, any area that moves a lot is probably going to need to be seen. And a wound in the area where scarring would be bad, like on the face or eyelid or lip or something like that, we're going to want to see that in the office and decide if we need to do anything about it. To summarize, the most common question we get is, does this need to be repaired? And I get these photos all the time of wounds. Does this need to be repaired? I have to say, it is sometimes very difficult to tell from a photo how deep or wide something is and whether or not it needs to be repaired. So don't be surprised if you send me a photo and I say, you're going to have to come in because I really can't tell from the photo. I'm not trying to make money. I'm just saying sometimes it is hard to tell whether or not something needs to be repaired. We want to do right by you and do right by your kids. So there's 3 reasons that something needs to be repaired. Number 1 is to reduce scarring. When someone gets a laceration and you'll see that their skin is open, what we do is we put the skin together, we put those sides together, and we sew across the top. Unless it's really deep and you have to put something in subcutaneous suture deep, we do just sew across the top, lay those sides together, and you should have a nice narrow scar. If you don't sew something, it will heal, but it'll heal kind of from the bottom and it'll make a wider scar. So that's why we like to put things together, is to reduce the size of the scar. The second reason to sew something closed is if there's active bleeding. We do need a little bit of bleeding. That makes it heal well, but we don't want to have a bunch of bleeding. We want to make sure that stops first. And sometimes the pressure of sewing something together will actually put like a compress on there. It'll stop the bleeding. And the third reason that we want to sew something closed is because an open wound is much more likely to get infected. So we want to close that, make sure there's no potential space in there for an infection to take place. There's one exception, and that's animal bites. Sometimes we do leave those open if it's not disfiguring, so that if there's any pus that develops in an animal bite, it can drain out. There are three main methods that we use for closing skin wounds. First one is using sutures, and that's what everyone thinks of. Well, do I need to get this sutured up? So absorbable sutures are sutures that dissolve, and sometimes you have to pluck them out of the skin because they don't come out completely. We don't use absorbable sutures very often. We usually use those in deeper wounds. You put them way deep, close the bottom layers, and then you're going to close on top, probably with a non-absorbable suture. So we don't use those very often in the office. We don't use those on the surface because it can cause a lot of inflammation and more scarring. Then there's non-absorbable sutures. Those are the kind that have to be removed, usually after about 5 to 10 days, depending on the location, what the wound looks like, whether it's healing well, that sort of thing. All you have to do with sutures is keep them clean and dry. Some people recommend cleaning around them with peroxide to make sure a lot of scabbing doesn't show up. Again, I don't think peroxide's the be-all, end-all of wound care. I think just using warm water and a little bit of soap and just being gentle with it is a good idea. But talk to your doctor about how to take care of your wound after sutures have been put in. The second method is staples. The staples are used almost exclusively on the scalp. They can leave a little scarring, but if you have, they're very easy to use. They're easy to get out. If you have someone who has a good set of hair, then it shouldn't show up anyway. And kids usually do have a good set of hair. And over time, that scar will probably go away anyway. These, again, have to be kept clean and dry. We do have a special staple remover for taking these out in the office. And the last one is glue. Now, glue can be very useful. It's great because very often when you use it, you don't have to numb the kid up. If someone has a laceration and we're going to sew or staple it, especially sewing it, we're going to want to inject around it or use something called Let, which is a ointment that we can put on there and numb it up. But generally, we like to use the injection because it makes it very numb and it lasts for a long time so that you can take your time and sew things up. But the glue is great because when you put it on there, it may sting a little bit if it gets in the wound, but generally it doesn't hurt when we use that. It should only be used on areas that don't move a lot. I've seen people use these on hands and knees, and it's going to break open. So we don't recommend doing that. For all you residents out there, please don't use this on knuckles or knees or around the mouth. Any place that moves a lot or is going to get wet, you cannot use this stuff there. It's really not going to last very well. Speaking of lasting, it usually lasts 10 days, 14 days, and then it's going to dry and crumble and fall off. Please don't let your kids pick at it. That's not good for the wound healing. You don't have to do anything with this other than keep it dry, don't let it get wet, and don't put any antibiotic ointment on it because that will actually dissolve the glue and it's going to come off a little bit too early. No one really wants to get a big old scar, so we're going to try to keep that minimized by keeping the area moist. Vaseline or Aquaphor should be fine. You don't want to get a lot of sun on newly healing skin. It's very sensitive, so using a sunscreen or keeping the area covered is also a good idea. A lot of people ask us, what kind of medication do you recommend over the counter? What about Mederma and those kind of scar reduction brand medicines? There's not really a lot of great evidence that says that this does much of anything. They're kind of expensive. If you can afford it, please go ahead and get some. That's fine. But using Vaseline or Aquaphor and massaging the area if you do get a big scar, that'll help to reorganize the scar and help break it down over time. Kids' skin is very plastic, and by that we mean that it reforms and it reshapes itself over time. So even a big scar usually will get smaller over a period of months to years. Last thing I want to talk about with wound care is signs of infection. How do we know that a wound needs to get checked out again? Well, the signs are going to be pain that's getting worse or swelling that's getting worse when it should be getting better. Redness or heat. Feel the wound, it feels like it's starting to get hot. See that redness spreading out from it. These are all bad signs. The last one would be something like bleeding or pus coming from the wound, or the wound starting to open again. Those are all signs that you're going to want to get checked out at your doctor's. So one of the most important points I want you to take home is, if your child gets a wound that needs to be repaired, or you think might need to be repaired, please get it checked out as soon as possible. If you wait longer than 6 to 8 hours, it's probably going to be very difficult to repair. It may need to be roughed up quite a bit. There may need to be some stuff scraped out of it. It's just not fun for anybody, and it may not heal that well. So don't wait overnight. Get it checked out right away. Thanks for watching today. I just want to say real quick, we passed 100 subscribers a few days ago. That really makes me proud, and I'm so glad that so many people are getting a lot out of these videos. Please subscribe if you haven't already, so I know to keep making these videos and that people are getting some help. Thanks for watching. I'm Dr. B, and this has been The Buzz on Pediatrics and Parenting. We'll see you next time.